Our Professor Klein here to bring you a video on the bone model. Let's begin. Okay, first off, where are we even at when we look at this model? Well, we are inside of a bone. We got the femur bone right here. We are inside here. So take a small chunk and blow this up, and this is what you're looking at. And if you notice on this bone, there's kind of a harder, whiter exterior. That's what we call compact bone. And then as you get more deep, it becomes like red and white, and it's a little bit more holy, or we call that porous or spongy, because that's the name of this bone, is spongy bone. So if I come over here, this is compact bone, and this is the start of spongy bone, but remember, there's a bunch of spongy bone deep in pretty much all the bones. Well, what are we working with over here? And I want to give you a 360 view of this model. It's a great model. You might use it. Comment if you use this model, and if you like it or hate it, let me know as well. Hopefully you like it more after this video and know what's going on. Well, externally here, we have what's called the periosteum. Peri means superficial or on top. Osteum means of the bone. This is connective tissue covering the bone itself, and it's hooked to the bone with these fibers called Sharp's fibers. And these act as hooks into these layers, which are called circumferential lamellae. Lamellae is a fancy word for layers. So see how these are layers right here? Well, we dive even deeper and we get into these birthday cake looking things, which can be smashed flat or it can be up like that. Remember, models are just cut of the actual thing, different cuts. So the way they cut it is to show you these things instead of just showing them flat. These are called osteons. Osteons, the structural unit of compact bone. I think they look like, well, birthday cakes here and then tree trunks over here. And an osteon has 5 different things. This is concentric lamellae. There's that fancy word again, lamellae, but these are concentric lamellae. Then you have these holes, which are called lacunae. Lacunae are these little holes right here, which would have osteocytes inside of them. And the best way to show that would be to show this jar. This jar would be like the lacunae. And then this thing, this balled up piece of paper, would be like the osteocyte or the bone cell, which would sit right inside. So not a perfect example, but hopefully that gets you thinking about what's happening right in here. Now there's these little lines. See these little lines right here? These little lines connect the osteocytes, and those are called canoniculi. Canoniculi, little canals. There's also another canal right here called the central canal, and it's a vertical canal going through the osteon. Now, in reality, I don't love the model for this reason. It should show blue and yellow in here, because inside of the central canal, which is also called an Haversian canal, there should be arteries, veins, and nerves. And there's even some lymphatic vessels in there too. So I still love the model, don't worry, but for that reason, it could use an update. Well, there are also these horizontal canals. These are called Volkmann's canals or perforating canals. And you can see one right here, jumping between osteons, some over here, going every which way, but they're horizontal. There's a blue vein for you there. And here you can see one without anything inside. So that's kind of cool. And then here would be a central canal with nothing inside. Great intricate setup of the osteons and how they're designed to give you structural support for bone. But let's keep going and let's make our way over to the spongy bone. Before we do, one last thing. In between osteons, there's a different type of lamellae called interstitial lamellae. It's like the in-between layers, interstitial. Now, if these are tree trunks, in between trees you have shrubbery, right? So the interstitial lamellae is like the shrubbery in between the tree trunks. All right, now we're ready for the spongy bone. We've got endosteum, which is this outer layer. Now notice, if I zoom in, endosteum is this outer layer covering all this stuff, and this stuff, it divides compact and spongy, but it does extend out to these things here. What are these things? Well, the endosteum plus the lamellae, more lamellae, just general lamellae though here, those things together are called trabeculae. So these two structures, the endosteum and the lamellae, is called trabeculae. And that's really what gives the bone support. As you can see over here, the red and the white, it'd be the white. What's the red? Well, the red is bone marrow, red bone marrow that makes blood cells. And those need to be produced quite often to keep the body strong and healthy. So that's what you can see right there. And then those blood cells would hop on the blood and zoom, jump out of the bone and go to the rest of the body. That is your video on the bone model. Remember, compact bone, spongy bone right here. Thanks for watching.